Okay, guys, so just briefly, we need food. Okay, for those who have studied biochemistry, they will know that whatever that we eat, most of the things that we eat, they end up being broken down by the body to a substance called glucose. Which is one of the basic blocks of carbohydrates. There are other ones as well. So but glucose is the main one, is the most common one. So whatever that most of the things that we eat, they get broken down into, I'm talking about carbs now, they get broken down into glucose. Proteins, they get broken down into amino acids, and then fats, they get broken down into fatty acids and all that, so that we can actually use them. So let's say we've eaten something that has got carbohydrates. It's going to be broken down into glucose in most of the instances. Now, this is what we want. We want the glucose because it's easy for the body to use the glucose for energy. Because we want to have energy. What is energy? No, let me not get there. But energy is the ability to do work. So we want to be able to work. We want to be able to breathe. Breathing is working. The muscles are working. There are muscles that are contracting. When you are breathing, they need energy. Walking, talking, all movements, we need energy, which is called ATP in the body. So this is why we eat. When we're able to run, we want to be able to pick up that whatever that we are doing. We want to be able to think, because thinking consumes energy. So we need that. Now, this is the blood. This is the blood vessel, and this is the cells. These are the cells. So when we have eaten, and then digestion has taken place, absorption has taken place, now the blood, now the glucose is in the blood, it's circulating in the blood. Now it needs, that glucose needs insulin for it to get into the cells so that we can use it. So they call insulin glucose taxi. So it's the one that actually takes, insulin is the one that actually takes glucose from the blood into the cells, all the cells of the body. Because when you've got glucose that is in the blood but not in the cells, you can't use that. The cells cannot use it. You just be tired as if you have not eaten. That's what happens with diabetic patients. They feel tired even though they've just eaten, because the insulin in them is deficient, or it's insufficient to actually take the glucose from the blood into the cells where it can actually be used, right? So this is insulin, very important, insulin. So people who are diabetic, they've got a problem with insulin. With type 1 diabetes, it's someone who's just not producing it, so they need an external insulin. With people who are type 2 diabetes, there's a lot of things that are happening there. There are insulin, there are some who've got deficient insulin, and then on the same patient, they've got problem with the receptors. Some has got, there's a lot of problems, and people are still debating. I don't want to get into that, but whatever that we know is sufficient to actually manage diabetic patients. So there's a lot that is being said around there. So people who are type 1 diabetes, they don't have, they don't have insulin at all. So because the cells that actually produce insulin, the islets of Langerhans, the beta cells, are the ones that have been destroyed, so they cannot produce it. But people who are type 2 diabetes, they can actually produce it. Some of them later on, they become insulin dependent later on. But when they start, they usually can produce it, but it's just not functioning because of different reasons that happen at a cellular level, which I'm not going to talk about right now. So I want you to get this. You have got glucose in the blood you have eaten. You want that glucose to get into the cells, because you cannot use glucose that is not in the cells. You need it to be in the cells. And the person that helps you to do that is the insulin. Let's get that very clear. So when you've got a problem, when you are diabetic, you've got your blood cells, not blood cells, you've got your blood in the vessels, and you've got your cells, and you've got a lot of sugar that is in the blood. You've got a high blood sugar, but the problem is that you don't have the insulin. There's a problem with the insulin, so you can't, this is not happening. So now you end up having a lot of blood sugar that is in the blood. So the blood sugar levels, they remain high in the blood. So let's make an example. Let's say I feel hungry and I take 500 mils of Coke with a burger. My blood sugar is gonna shoot. It's gonna be very high. It's gonna be very high. My blood sugar is gonna be very high. But because I'm not diabetic, so my insulin is still functioning. So within 2 hours, that blood sugar is gonna drop. And the reason why it drops is because the insulin is able to take that glucose into the cells. That's why it drops. But with diabetic, with people who are diabetic, because the insulin is not doing the job that it's supposed to be doing, so they end up having high blood sugars, after they've eaten, high blood sugars that remain high. And this remaining high is the one that causes problems. A chronically elevated blood sugar is the one that damages organs, because it causes some chemical reactions there at an anatomic level, and the organs, they start being damaged. That's what you don't want. You want a blood sugar that goes up and drops, because you've got an effective mechanism of dropping the blood sugar, which is the insulin taking the glucose into the cells. So this is a normal person who eats whatever that they eat. Their blood sugar goes up, then it goes down, because the insulin is taking the blood sugar and transporting it into the cells. But here, if for a person who's diabetic, they've eaten, the blood sugar increases in their blood, or the sugar becomes very high in their blood because they've eaten. But the issue, they can't transport it into the cells. So these cells, they are starved, even though there's glucose in the blood vessels. But these cells, they're not starved, because the glucose that is outside there is going to enter into the cells. Then the cells are going to be able to utilize it, and respiratory metabolism, it takes place. So metabolism occurs, it gets broken down, and then ATP is produced, right? I'm gonna try and represent this using a graph, but it's not gonna be drawn to scale, so please don't punish me for that. So let's say we have a graph here. This graph, okay, firstly, before I get to that, a person's blood sugar if if they are fasting or they've fasted, they've not eaten, they wake up and then they don't eat anything, then they check their blood sugar should be less than 6.5. Some people say 7. So it should be less than 6.5. If you are waking up and your blood sugar is less than 6.5, then we can say that you are not diabetic. Yeah? But for people who are diabetic, their blood sugar, their fasting blood sugar is more than 6.5. Now, if you have eaten and then we check your blood sugar, it's called a random blood sugar. Random blood sugar. It shouldn't be more than 11. So it should be less than 11. Once it's more than 11, then it means once it's more than 11, okay. Once you want your blood sugar to be less than 11 after you have eaten and 2 hours after you have eaten. You cannot eat now and after 5 minutes, 15 minutes you check your blood sugar, it's going to be high and you're going to misdiagnose yourself and say you are diabetic. But you need to wait for 2 hours after you have eaten to check your blood sugar. That's a random blood sugar. That's why some people are when their blood sugar is on the borderline, you are not sure, you can do what they call a glucose tolerance test. You give them something that's got glucose in it or something sweet, and then you check their blood sugar after 2 hours, and then you see what's going to happen. So a person who's got diabetes, we are diagnosing them for the first time, their blood sugar should be more than 11 before you can consider saying that they are to diagnose them. But a blood sugar that is about 12, 13, 14, rather investigate this person a little bit before starting them on treatment. But 15, 16, 17, 18, 20, you can just say, okay, now they are diabetic and start them on treatment. So this blood sugar is for a normal person when they've not eaten. This blood sugar is for a normal person when they have eaten. So someone who is diabetic, who's on this side, when you give them treatment, you want to convert them to this. You want to bring them back to this. That's why you give them treatment. And now this is what I want to talk about. When you put a patient who is diabetic, controlling blood sugar is not only about, like I said, it's not only about drugs. There's a diet there, which is about contributes about 90%. That's what I want us to talk about. Okay. Now let's talk about someone who is not diabetic. When it comes to the diet, let me just get there first. When it comes to the diet, there are two things there. There are two categories. We're going to talk about low GI and high GI. Low GI and high GI. Oh, my G is like an S. That's better. So high GI, high glycemic index, low glycemic index, that's what we're talking about. We want a patient who is diabetic to be taking low GI index. This is not good for a diabetic patient, and I will tell you why it's not good. That's why I'm making this video to tell you about high GI, their impact on a patient, on a blood sugar of a patient who's diabetic. So when you are not diabetic, let's make this graph. So this graph, this is gonna be time, this is gonna be blood sugar level. So let's say at 6 o'clock in the morning, I wake up. When I wake up, because I'm not diabetic, my blood sugar should be, let's say it's around 5. But the most important thing, it's less than 6.5. So my blood sugar is here at 6 o'clock, but I'm feeling hungry. So, but I'm like, okay, I'm gonna wake up at 8 and eat. 8, 9, 10, 11, 10, 11, 12, 2 o'clock. So, this is a normal person. This normal person is gonna eat high glycemic index. I wanna show you what it does. So I wake up at 6, but I don't eat. Maybe by the time I eat at 8 o'clock, my sugar is 4 point something. And then I eat at 8.